And let's finish up with the nails. So when you look at the nails, you have the free edge, you have the body, you have the lunula, you have the cuticle, and then you have the nail root. Okay, this is the free edge. This is the part that you clip and cut. This part is pink because of the blood that we see deep to it. When we see it white, we think that the person may be anemic. Okay, when this looks white, we think anemia. When this is pink or red, you're thinking there could be a little bit of an infection back here when the cuticles are infected. So now here is the free edge. This is the distal phalange. Here's the free edge. Here's the nail body. Here's the lunula. Here's the cuticle, also known as the impochium. Here's the nail root. And just posterior to the nail root, this is the nail matrix right here. The nail matrix is the epithelium that's proximal to the nail root, and it contains dividing cells which produce new cells, new nail cells. So this is going to multiply and divide and push the nail forward. That's what makes your nails grow, and that's when you have to clip them. Okay, so right here, this is the nail body. Right here, this is the nail root. The nails are really important from a clinical perspective. Whenever I examine a patient or I shake their hand, I turn the hand over, and I always like to analyze the nails. It can kind of tell me a lot about their health. If they have some sort of lung pathology, or there's hypoxia due to like a lung cancer or some sort of heart pathology or heart disease, you start to see the thickening of the nail here. They call it clubbing, where the cuticles get very, very thick and you get the nail that protrudes downward like this. This is early clubbing. This is severe late clubbing. It's seen with hypoxia. It's usually secondary to advanced lung disease. This is what it looks like down here, where you can see the clubbing. Okay, typically a sign of lung disease. It can also be seen with irritable bowel disease. We've seen it with patients with IBD, and we also see it with cardiovascular disease, liver and AIDS issue. Here's the normal nail. You see where this gets very thickened with clubbing, really starts to hypertrophy and thicken up here. When the nail bows upward, we call it spooning of the nails. We see that with severe diabetes. We also see it with severe fungal infections. When we see white nails, I'm thinking most commonly anemia, like iron deficiency anemia, or even B12 pernicious anemia. And it can also be, we look at the nails, we see this black line here. This is a type of skin cancer, very, very dangerous. You know, skin cancer can affect skin, also now called a sublingual melanoma right here. Then we could see we have these vertical ridges. These vertical ridges are typically, they look like dripping wax. That can be seen with diabetes. It could be seen with a thyroid issue. It could be seen with Addison's disease, where there's a cortisol issue affecting the adrenal gland. It could be seen with chronic stress and even B vitamin deficiencies.